But if no come, okay. As in just, you know.
Hey, why? We're all professionals here. Very funny, man. What would you do if you found out your partner was HIV positive? This is your daily Ketchup.
Boom.
This episode is made possible with the support of the National HIV Programme under the National Centre for Infectious Diseases, also known as NCID. Global and local studies have showed that many of us actually don't know our HIV status, and actually all of us here are guilty of it except John and I assume Dr. Wong. And we don't even feel a need to get tested. But the fact is that some of us are actually at higher risk of HIV infection, and it's very important to detect early because it is key to successful treatment and to prevent unconscious spreading. Yeah. So today we have Dr. Wong back with us.
One of our favourite guests, our OG guest of TDK.
Yeah, back when we were all set.
Yeah.
So some of you might recognize him. He was previously with us to explain more about HIV in general, and today he's back to be answering some of the comments that you've left in that video, as well as talking about like testing procedures in HIV and giving us more insight into that. Yep.
Also, all of us went for a HIV test, but more about that later.
Yes. So for those of you who don't already know, Dr. Wong is the Deputy Director of the National HIV Programme at NCID.
Wow.
Big shot.
And he has actually authored many of the local studies with which I've mentioned earlier.
Authored. I heard authored. And I was like, wow, you can do that shit. We're bragging about that. Authored. Yeah, okay.
Okay, so to recap, right, in our previous episode, we actually talked a bit about HIV transmission, the impact of being tested positive, addressed some of the misconceptions, and learned more about treatment options. So you can catch it linked down in the description below. Okay, the first comment is by Evan Chu.
Let's go.
So he says, I'm going to dispute what John Paul says about PLHIVs or people living with HIV. So he basically says that he disagrees that it is down to PLHIVs to be open and to be sharing their status and starting conversations in de-stigmatizing HIV, because like the fact that they are afraid of that, right, shows that there is still some form of repercussion, there is still some form of stigma against it. So, but I mean, like when I think about it personally, in my own friend circles, right, I'm not just going to randomly bring up, hey guys, you all know we shouldn't like stigmatize HIV. You know what I mean? It's like, unless someone gets tested positive, touch wood, right, or yeah, there's just a like case that blows up in the media, for example.
Yeah, so I think Evan Chu's comment really gets to the heart of things, right? Oftentimes we say, we think that people living with HIV, because they are the ones who have got that experience, then it's on their shoulders to talk about it, to educate other people about it. But I think the burden or the responsibility, if we take a more positive slant on things, really falls on everybody, right? To educate ourselves about HIV and to not expect people who are already experiencing, like you pointed out, a significant amount of stigma and discrimination in their everyday lives to then also take on the additional burden of educating the people around them. There's similarities, I think, with other conditions and other chronic conditions like cancer, for example. You know, we say that oftentimes it's people who have lived through those experiences that have the most ability to share their what they've gone through and to educate other people. But unlike cancer, I suppose HIV comes with it a certain stigma, right? And it can be challenging. But I also take your point, right, that we can't just sit down, hey, let's talk about HIV today. To that I say, why not? We can do that, right? If we think that it's important enough, we can perhaps spend some time doing that. I think it also boils down to the fact that not all of us maybe know people who are living with HIV, and it's a chicken and egg thing. We maybe don't know because nobody's talking about it. So I think a middle ground perhaps is exactly by having conversations like this, where we are talking about it on behalf of people who are experiencing the challenges that HIV brings, but also on behalf of people who may never encounter this in their everyday lives. And by putting these conversations out there, I think hopefully people will find out a little bit more.
So in starting these conversations, right?
So it's on us, basically, is what he's saying. It's on the daily Ketchup.
Is there stuff that I should avoid saying, for example, if I want to bring this topic up? Whether it's offensive to them or it might accidentally hurt their feelings about like when I say certain things, you know what I mean?
So I think one of the most important things is to understand that there are as times have changed, our vocabulary around HIV has changed, right? Even in a clinical setting and in the hospital setting, we tend not to talk about people as HIV patients, even because that minimizes or it boils down their entire experience and existence into just that one aspect, right? They are more than just their HIV. So we talk about people living with HIV as a aspect of their experiences and of their lives. So,
but do you not do that for cancer patients, for example? Do we call them people living with cancer?
we don't necessarily, but then remember what I said, cancer and HIV are quite different. Rarely do you have a condition where there are so many social aspects to
I have
it.
an example. Living with autism.
Hey, what happened to your voice? Welcome to puberty.
yeah. My voice box developing. We cannot say autistic now.
Yeah. So and these are things that may have been acceptable 10 years ago, 15 years ago. But I think as we have learned more and as we have come to understand that, especially the particular challenges that people living with HIV face, sometimes the words that we use are fairly powerful. I think also an important thing is to, when we talk about it, unless we have people's expressed permission to not talk about things that would be easily identify who they are, right? Yeah. And this includes saying, we know a mutual friend of ours who is XYZ years old may have some experience. Things that may inadvertently expose or identify people should be avoided as much as possible.
It's funny though, but we do it.
Yeah.
Stop right there, just like we are stopping the spread of HIV. Okay, like, share, and subscribe. Back to the episode.
Do you feel like it's a cycle? Like, at some point, I mean, those kind of media depiction worked for us growing up in a sense whereby it really drills down that we need to be careful on like with who we sleep with, right? But now we flip, right? Now we show people living HIV as normal, healthy people. They just have it lah, right? And at some point, it will become so liberalized again to have it. It might even be cool to have it. We don't know what. I mean, we look at how the world has evolved, right? It's hard to say. Like at some point, drug addiction was cool. At some point, smoking a cigarette was cool, right? And then we had to keep flipping and flipping that narrative, right? Then do you feel like at some point, this will then flip back? That we'll then need to talk about the dangers of having HIV again? Similarly to how we continue to make new words for things that we cannot say anymore. Yeah, which was totally acceptable just a year before. Yeah.
I think it's important to draw a distinction between speaking about HIV in a way that is non-judgmental and non-stigmatizing, and also conveying the correct, I suppose, or the appropriate health message out there. To flip the question back to you, which is that, will it ever be cool? I think we have to be very clear in our heads that HIV infection, I mean, amongst all of the people that I know, the patients that I care for, I don't think any of them would say that this is something that they would knowingly or willingly choose, right? And we have to be very clear that even HIV that is detected early and treated early, it is still a chronic lifelong condition, right? Albeit it is something that we have a lot of ways to make people's health really quite good for the entirety of their life expectancies, and that is due to the advances in science and medicine that we have. But it is still a process of needing to be on treatment and medication, requiring lifelong sort of follow-ups with a doctor, and does require adjustments made to one's life, right? Not least of all taking medications daily, and lifelong. So I think the message here is not that we are, definitely not that we are encouraging people to have high-risk behavior. That's really the opposite of what we are getting at here. But really that there are a sizable community of people who are living with this chronic condition, and how can we make life better for them, right? Because this is, once again, the duty of healthcare professionals, yes, but also the rest of community, right? Of making sure that these people living with HIV already have certain odds that are stacked against them. And as their fellow men, we should be really trying to make life better for them rather than more difficult. I think that's the angle that we should come at.
In your experience with working with people living with HIVs, like even in the last year or last 2 years, given that there has been a rollout of better messaging, has their lives, have they shared an improvement in any way in a social setting so far?
I think the fight against HIV-related stigma and discrimination is still one of the major challenges that we face. We would like to think that there are improvements, right? Definitely around messaging, definitely around access to healthcare, and definitely around the environment that within healthcare institutions we provide for them. Unfortunately, there are still, incidents where people face challenges at home, where people face challenges at work, where people face challenges in their everyday lives. Most of the time, it is due to just a lack of information, a lack of knowledge, and hence people say things or do things that are inappropriate. And that is where I think conversations like ours are so important, and the work that is done by by the media, that is done by, of course, by professionals to try and improve situations and circumstances for people.
So if they have HIV, is it required for them to mention it to their boss at work?
So that's an excellent question, and a question that my patients are always asking me as well. Unless the person living with HIV is working in a profession where there is potentially a risk that they might transmit the virus onto others in the workplace, then there is no requirement for them to inform their
So what are some
employers.
examples?
As you can imagine, most of them would be in the healthcare setting, right? But not all healthcare professionals, right? Only healthcare professionals who are in certain jobs where they are more what we call exposure prone, where there's a higher possibility or risk that they might sustain an injury, where they might have some contact or exchange of infected body fluid from them, from the infected person to an uninfected person.
Or what if you are working in the fast food industry, for example, then your saliva, if you're HIV positive, then your saliva accidentally pop on the food.
Oh, hey, okay, who want to go?
Then
Never watch Daily Ketchup.
Oopsie. I haven't joined.
Okay, so first and foremost, most F&B staff should be wearing a mask when the preparation of food. But secondly, there is no HIV in saliva. So in order for HIV to be transmitted from an HIV positive person to HIV negative person, it must be through the exposure to a body fluid that has virus inside, right? When this includes blood, as well as what we can call, blanket term sexual fluids, right? Semen, vaginal secretions, and so on. Yeah, it is not present in saliva, right? Unless the saliva is what we call visibly blood-stained. That means when you spit, right, there's blood in it, and it's not the saliva; it is the blood that contains the virus.
Okay, important question. So Dan and I actually took the HIV self-test. So for those of you who don't know, right, it's actually, the packaging is very, very similar to the ART. So then after that, there's a bottle of liquid inside, and then a swab that does not look like the ART swab. But basically what you do is you go around your gums here and then your gums here, and then you let it stand in the fluid for 20 minutes. So, and then it's the same, it's the C and
For 20 minutes.
Yeah, and then it's the C and T. So double line means positive, then single line is negative. And you cannot read the thing after 40 minutes. So you can only read the thing between 20 to 40 minutes. After 40 minutes, your test result expires.
Right.
Yeah, but interesting. So now that doctor has mentioned that the virus is not in saliva, right? Then how come I'm testing using my saliva?
Yeah.
So
I guess.
Okay, yeah, you guess.
Are you making micro cuts on your gum?
So I'm injuring myself through this test?
No. Let me
Why straight away don't
let me nip that in the bud. So the answer is no. You're not causing micro injuries on your gums. The reason for that is that rapid test that we are doing is not looking for HIV virus. We are looking for HIV antibody.
Explains so much accidentally, unlike John.
Yeah, so
damn.
So the antibody is something that our body produces in order to try to fight off infection, right? So if a person has been exposed to the HIV virus, right, because they got infected either through contact with infected body fluids or unprotected sex and so on with somebody who has HIV, your body's immune system recognizes that this virus is in your body and it's not supposed to be there. And so what it does is that it produces antibodies to try to fight off the infection. And what we are doing with the rapid test that you did with the oral fluid test is to look for the antibodies inside the saliva.
Yeah.
There's no virus there, but there is an antibody there.
Right.
And the antibody will tell us this is someone who has been exposed to the HIV virus before, therefore telling us that they are infected or not.
But I will have no symptom of illness until it becomes AIDS.
Most of the time, yes.
Interesting.
Yes.
So detect early.
Detect early. And most people will have no symptoms and no outward signs that they are infected. And hence you can't just use your what you see on the surface to tell you whether what the risk is.
Right.
Yeah.
Why the gum though?
Instead of like the.
Why don't I, for example,
Like, why
spit
can't I
it?
lick it?
Like
Why
the
can't I
back of my
spit it?
throat.
Or like,
So this is just one type of test, right?
Yeah.
And for those of you who don't know, the reason why we have this home self-test kit is because the National HIV Programme, we started off a pilot program of HIV self-testing where you can actually buy these tests for your own use, available at the DSC Clinic and Action for AIDS anonymous test site. So we decided to use this particular test kit, which is
Right.
approved locally for use. But actually, if you look online or you look in other places, there are many different types of
Right.
saliva tests. There are some where you sort of like spit into
Oh,
a
really?
little
You
tube.
can spit. I see.
There are some where you, most of them will require you to sort of do a swab like this because it's easier than spitting essentially. Yeah.
So inside the test kit, right, there was this tiny like plastic, like almost container thing. Then after I took it, I asked Dan what is it. He told me it's to spit saliva. Then after we open up the instruction paper, it's for you to put there so your tube can stand.
It was upside down. It's a stand. No, because I've heard before of like HIV tests where you spit. So I was so convinced, but it wasn't.
Were you scared though when you took the test?
A little bit, but I was just happy. I would have been more scared if I had to prick myself because I'm scared of needles.
which I had to do.
She's
Thanks,
so brave.
Alison. So
Because
brave.
John
She's
Paul is
so
not
brave.
here.
So brave.
No, so I went to the clinic to do the anonymous test.
Yep.
So what they did, right, is they pricked my finger
Yep.
and then they took out some blood and then put it on the test, similar to the ART one lah.
Wait, so it's not this one
No.
where they draw?
No.
Oh.
So it was just
It's like the
little
blood sugar
prick.
kind.
Yeah, it felt like a stapler bullet a bit. And then he extracted some blood and then put it on the test lah. And then it's the same control line.
Right, Yeah. right.
Yeah. But
The stick is a bit like a, because I went with her. It's a bit like a,
Lollipop.
you pee on that. Oh. Wow, we really went different directions. Yeah, let's go with
I
lollipop
never
lah.
pee on the stick before.
Yeah, you go help check out, then you have to pee on that stick.
I've never had to.
Yeah, okay.
I'm so sorry. I want to
Yeah,
be.
it looks like that.
No,
Then
to me,
it's
look like the
inside.
lollipop. Like after you eat, then just the stick. Then they stick the
Yeah.
blood out.
Right.
Let's go
Okay,
with
okay.
lollipop lah.
Yeah. No, but I was quite surprised by because it's anonymous, right? I mean, although y'all know it's me, but the paper, right, that they fill up they ask you to fill out, right? They really make it totally anonymous. Like you only need to put maybe your gender or your sexual orientation.
Yeah.
But then there's a box non-disclose also.
It's so,
Okay.
the piece of paper is so,
It's like
inclusive.
Yeah, inclusive.
yeah, they put heterosexual, binary, non-binary.
Oh.
Yeah.
Like,
Right.
not even male, female, It's just
Yeah,
heterosexual or something like that.
Then the clinic don't even call me by my name.
They just, oi.
Like they just
182506.
No, they just say, okay, miss, please sit here. Okay, miss,
Alright.
go eat.
Yeah, it was so cool. It was so cool.
Oh,
Yeah.
okay.
Then the doctor handsome, but I never see. Here's my case. Here's my case.
Hey, that's not what she's there for.
Yeah.
Here's my case.
But the doctor told me something quite interesting. He said the test, right, if you let's say suspect you have, right, you can't take the test immediately after that.
Yeah.
After the encounter, he say normally safe
It's like
period
incubation
is
period or something like that.
maybe 3 weeks later or
Yes.
3 months later.
So what the doctor is referring to is the window period for the test. So all tests that we have a certain window period, which means that if you suspect that you were infected, right, there will be a period of time from that point of infection that the test will not be very accurate. That means even if you truly were infected, it won't be able to tell you. So that's what we call.
Is this test directly testing for the virus, or is it also testing for antibodies?
So that's so the finger prick test or the blood test that we draw will usually test for two different things. It will also look for the antibody, but it may most of the tests that we use now will also check for parts of the virus, a portion of the virus. So those that will check for a portion of the virus usually have what we call a shorter window period, which means that if you, let's say, had a high risk exposure yesterday, right? The tests that detect a portion of the virus itself may quite accurately tell you whether you are or are not infected after about 3 to 4 weeks.
Right.
Right? But if you were using a test that was only looking at saliva or the antibodies, that window period may be longer. So we'll say that window period may last as long as 6 to 12 weeks.
Because the antibodies haven't developed yet.
Yes, because we are detecting something that the body is producing, and it takes a certain amount of time for the body to produce enough antibodies, right, that your tests can look for it accurately.
So y'all might actually have it lah. Is what he's saying.
No, but I don't have any high risk exposures within the last 6 to 12 weeks. What do you mean?
But the doctor also told me there's this thing called like the PEP pill. So when he explained, right, it's not something like a plan B. So like, let's say you have an encounter that you think you might have HIV, right? You must like go to the doctor and take this pill within 72 hours, and then it will kind of like prevent you from having HIV infection.
Yeah, actually PEP and
Isn't that so great, guys?
Yeah.
What the heck?
I
There's
thought-
so many.
PEP and PrEP, there's two. So quite a few people in the comments also asked about it.
Right.
Okay, so I guess we can talk about it. So what the doctor was telling you about PEP stands for post-exposure prophylaxis. Post means
Prophylaxis.
after.
It's so eloquent now.
Exposure.
Prophylaxis.
Like we're
Prophylaxis.
talking about sex here, you know what I'm saying? Like, it's so eloquent now.
Post-exposure.
Yeah, can I also
Yeah.
say like the drug makers and the doctors are so important, but the branding person
Yeah.
that comes up with the
like,
pills.
The people had to ask her, when's the last time you had sex? Right? And then so they say like, when was the last time you had exposure, or were you exposed?
Yeah.
Like they want to ask, are you a virgin? It's like, were you exposed?
Yeah.
What?
Are you an exposed
It's
individual?
like when the doctor tried to ask, is there any chance you could be pregnant?
Yeah.
Yeah.
Okay, anyway.
But sorry, you were saying, doctor, yes.
So back to post-exposure prophylaxis.
Wow.
Essentially, if you have been
Prophylaxis.
exposed, we have a window, or we have a period of 72 hours after the point of exposure, where if you start taking medications, we can actually prevent the infection from actually taking hold or taking place.
Right.
The medications that we use are actually HIV meds. They are the exact same drugs, the exact same medications that we will give to someone who actually has HIV infection. And they work in exactly the same way. They stop the virus from creating more copies of itself. or from
So if you
replicating.
detect it and you can treat it early enough, within 72 hours, then there's a good chance of curing it. It's just after 72 hours.
We don't think about it as a cure, we think about it as blocking the infection from even taking hold in the first place.
Right.
But what's the success rate like if you take the pill? Like, is it 100%?
Asking for a friend.
Where got 100%, man? I think 100%.
And this is asking some weirdly
99.99.
specific questions today.
only mouthwash is 100%.
So no, even mouthwash they'll say 99.99%.
No.
right?
Kill of germs, but they'll say 100% of your mouth.
Yeah.
I'm
Success
so
rate.
used to the 99.9, right? And then when I saw on my Listerine bottle, it's 100. I was like, the audacity. Then I read, it covers 100% of your mouth. Of course lah, heck.
Okay, yeah. So with post-exposure prophylaxis, the success rate is very, very high, right? PEP is very, very high, and we're talking about more than 90%. lah.
Oh.
Yeah, we're really talking about more than 90% protection. It's very difficult for us to give a very confident number because it's not ethical for us to design clinical studies that give you a success rate, right? Because we cannot say, we cannot have a study where we compare, okay, we give you PEP and we don't give you PEP and we see what is the difference in HIV rate, right? It's not
Right, right,
ethical.
Right.
And so what we have done is that we have had to use a lot of historical experience, right? Because obviously PEP didn't exist about 30 years ago.
Right.
But it is in existence now and we give everyone. So when we compare, okay, 30 years ago, what was the HIV rate amongst people who were exposed versus nowadays, we can come up with this rough estimate that is more than 90% protection.
Okay.
And so if I if I feel like I had high risk exposure yesterday and I go to a doctor and I get these PEP pills, right? How long do I take it for?
So you take it for 28 days.
Right.
4
Every
weeks. Every day for 4 weeks.
As opposed to your whole life though.
Yeah. So
I sure
Small
forget,
price.
I'm so
Small
stressed.
price to pay.
I sure forget.
So we usually tell our patients that, for the next 4 weeks, it's very important that you take the tablets every day. Set a reminder if you need to. Although in my experience, most of the time when people come in and they are anxious or they're worried enough about the exposure that they've had, they will
Very
usually
hard to
remember to
forget,
take.
yeah.
Yeah.
And if let's say I don't have, like I panic for nothing, it's just no problem. I can just take the pill for 28 days. Doesn't affect me.
Yes.
What if you're a bit late? Like you come in 100 hours after instead of 72 hours.
73 hours.
So the experience and the data or the research that we have shows that the greatest effect, the greatest benefit is if we start it within 72 hours, right? Because if you think about it, the sooner you start it, the less the virus would have had a chance to create more copies of itself and to spread to the rest of the body. Of course, if someone comes in 80 hours, right, 84 hours, because they just did not have the chance to see a doctor before that, the discussion that we have will really be on a case-by-case basis.
Right.
In certain situations, if we feel that, okay, there's still a small chance that, or if the exposure was like really high risk, we might still do it. But this is really a discussion that's best had with somebody who's an expert in giving PEP. And so we still counsel people, if you had a high risk exposure, do seek medical attention as soon as possible.
Sorry, we keep talking about high risk exposure. Like what counts as high risk exposure though?
So generally speaking, we would consider that to be unprotected sex, so sex without the use of a condom, especially if there was kind of like ejaculation or if there was a lot of body fluid that was exchanged.
But if no come, okay. As in
not
just
Hey, why? We're all professionals here. Very funny, man.
So yeah, just use the medical term for cum.
like if
What is
just
it?
like
don't know.
semen.
I don't know.
Like the guy never come, but then they still like
I think as long as there was penetration, right, there is still a possibility that the virus could have spread. So generally speaking, we say any high risk exposure is anything where there wasn't the use of a condom, or if you had any suspicion that the condom wasn't used correctly, or if the condom was broken in some way or slipped off or was taken off at some point in time, or if it was a new partner, especially a partner where you're not very sure of what the
History,
the HIV status is, we will
So
consider
eloquent.
those to be high risk exposures.
Let's see if we can try to say something dirty.
So the other sort of high risk exposures would be if we're talking about sexual exposures, apart from what we talked about just now, where it was consensual, but maybe not without the use of a condom, would be non-consensual sex. So victims of sexual assault, right? Especially, in those situations, usually the ability or to negotiate for condom use is not there. So I think we would definitely consider the use of PEP in those situations.
Right.
And then the next one would be in non-sexual context, right? Either, let's say, a healthcare professional who gets accidentally pricked with a needle or cut with some other sort of blade or sharp object, or people who were kind of using injection drugs and were, sharing needles and so on. Those would be high risk for transmission of HIV.
Wow.
Wait, so
That's
if like
super high risk.
for example, if the doctor draw my blood, then he dropped the needle, then he oops, and then it pricks him, then he might have.
If the person that he was drawing blood from had HIV,
then he immediately take the pill.
yes. So in those situations, for healthcare professionals, we'll ask them to take the pill straight away. Yeah.
So actually, okay.
Have you gonna prick before?
Many years ago when I was a junior doctor, yes. So I also took the medication.
And did you think it was high risk? Was the patient
It
someone living
was
HIV?
it was a high risk exposure because I was working in a ward where there were some people living with HIV.
Right.
So the patient that I pricked myself on was a patient.
Oh God!
Oh,
So
shit.
that's it, medicine law. And I can tell you from experience that you will never forget to take the tablet.
Yeah.
Oh my god.
Yes.
No, but how do you keep your shit together like that?
Yeah.
Like, do you scream out when he prick you?
No,
Like in front of your patient, you go like.
I mean, it's an anxiety and nerve-wracking experience for everyone involved. Accidental, you prick your finger, then my finger was bleeding. Then I went to see see the duty doctor.
But did the guy look at you like the person you are drawing blood from?
No, the patient didn't know. The patient didn't know, yeah. Ever since then, since this is my specialty, I've seen so many of my colleagues and my juniors and even my seniors who come in and they have sustained an accidental
Yeah,
injury.
shit happens lah.
But with the experience that we now have, we can tell them that we can try to reassure them and tell them that, look, it's good that you kind of detected it, you came in to
Yeah.
get treatment, we'll start you on the treatment. It's going to be highly effective. And just
And they know that, they know that. They're just like talking to themselves in the mirror.
in a way, yeah.
Yeah.
You have to
Yeah.
give them a pep talk. Hey.
Hey, then they eat the pep.
Yeah.
So what's the other one? The PrEP.
So PrEP stands for pre-exposure prophylaxis, right? So one is post and one is pre. And so with pre-exposure,
And if it's the same thing again, I'm gonna flip, yeah.
Prophylaxis.
it actually is.
No way!
But it's okay. It's slightly different. It's slightly different. It's slightly
Marketing.
different. With pre-exposure prophylaxis, what you have is that if you have someone who is at risk of being infected with HIV, right? So someone who has ongoing sort of risky behavior, let's just say, for example, if they have a partner who they are not sure of the HIV status, or if they are in a setting where they are not confident that they can use condoms 100% of the time, then using pre-exposure prophylaxis actually is a very effective way to greatly reduce the risk of HIV infection. Now, pre-exposure prophylaxis is also HIV medications, right? But the difference here is that when it's PEP, as well as for people who have HIV and we're giving them medications for treatment, we usually give them a combination of 3 drugs.
Right.
Cocktail.
3 different active ingredients exactly.
Okay.
Right? But with pre-exposure prophylaxis, we only need to give them 2 drugs, 2 active ingredients.
But no difference to the person,
And
lah.
it's usually combined into 1 tablet. So they just essentially end up taking one tablet. Yeah.
But the pre one is take one time. I just take
No,
one.
so the pre one is you take it. There are a few ways of taking it. One is what we call daily PrEP, which means that you just take 1 tablet every day.
It's like birth control.
In a way, yes. The other way of taking it is what we call on demand. That means you only take it when you are sexually active.
Okay.
So if the person thinks that, I'm gonna have sex tonight, they take
He said it.
tablets before it, and then they take a couple of tablets the day after, and 48 hours after that. And if the rest of the month, let's say, they're not having sex at all, then they don't have to take any tablets.
Oh.
Yeah. It's very important for us to also understand that PrEP and PEP are not, they should not be viewed as the only way of preventing HIV. Right? It's still very important for us to know that both PEP and PrEP are part of an overall strategy, HIV prevention strategy, which includes ABCD.
Right.
A meaning abstinence from casual sex, B meaning being faithful
Wow.
to
Faithful.
your partner, C meaning the correct and consistent use of condoms, and
CCC.
Wow.
and D meaning detect early. That means getting
Right.
tested early and then treatment after that.
It's
lah.
really ABCD.
It
Oh.
is ABCD.
I thought you
but-
were just saying like A, B, C, D. and then-
No, but
no.
A and B is about the same. If like ACD just doesn't hit the same.
Yeah.
So I'm curious, here's a scenario, right? Like in the previous episode, we spoke about HIV meds suppressing to the point where it's almost undetectable, right?
Yeah.
And so, like, say for example, a husband and wife together, one of the partners is HIV positive, but they're taking meds to suppress it. If they were to engage in a sexual, if they were to have sex, does the other partner, the non-person living with HIV partner, need to take PrEP?
So it depends, I would say. In the scenario that you point out is actually in a lot of what my patients encounter, right? They're a married couple. One person is living with HIV or HIV positive, one is HIV negative, right? But they want to start a family. Obviously, in that situation, you can't use barrier protection, you can't use condoms, right?
Yeah.
So what I would then tell the HIV positive partner is that we will start you on medications as soon as possible, get your viral load undetectable, and then remember what we talked about in the last interview, which was U equals to U.
Yeah.
Undetectable equals
Equals.
to untransmittable.
Yes.
Right. So in that situation, the person living with HIV who is undetectable, even if they are trying to start a family, even if they're trying to conceive, the risk of transmitting the virus onto the HIV negative partner is essentially zero.
Yeah.
Right.
Right. In some situations, people may think, okay, I want an additional
Yeah.
level of protection.
Understandably, right.
In which case, then we will recommend the use of PrEP is one option
Yeah.
for the HIV negative partner.
Okay.
If it's, we also have to consider that PrEP only protects against HIV. It doesn't protect against other sexually transmitted infections like gonorrhea, like syphilis, like chlamydia. So if we want to protect against those, then using a condom consistently and correctly would be the best.
But are those examples that you cited, are they also lifelong diseases?
No. So all of the other sexually transmitted infections that are out there are generally things that are easily treated and cured.
Asking
said-
for a friend.
Oh, I see. But when you say easily, hey, you go lah. I think you go.
I want to ask doctor question.
Okay.
Okay. So let's say is the lady who has HIV, but then now is undetectable, and then they had sex, then she become pregnant, then she give birth, right? Then does the baby have like undetected HIV?
So for women who become pregnant while being HIV positive, we also tell them that the best way to prevent transmission onto the child is to become undetectable as soon as possible. As soon as possible, preferably to become undetectable before getting pregnant, right? But even for women who are, let's say they become pregnant and then they discover that they're HIV positive, right? Then we will ask them to start treatment as soon as possible. With our current medications that we have, they can go from a detectable to an undetectable viral load within as short a time as 4 to 6 weeks. So very quick. Yeah. And as long as they remain virally undetectable, their viral load is undetectable during the rest of their pregnancy and during the process of childbirth, then the risk of transmission onto the child is greatly reduced.
Right. And also, you can take this medication during your pregnancy. It doesn't
Yes, you
affect
can.
them.
You can.
So there's no way that the HIV can be passed on to the child if they are undetectable lah.
The risk is reduced greatly.
Oh, so
Yeah.
the child come out, they still have to check the child.
Yes. So all babies who are born to mothers living with HIV will usually be closely monitored and followed up. Definitely during the first few years of their life.
Right.
HIV checks. They may be given HIV treatment, medications for a short period of time
Just in
until
case,
we are very sure that
Right.
they are HIV negative, but still will continue to follow them up for a period of time. Yeah.
Okay, so on that note, there's actually someone that's asking. So this is HH asks, if the viral load is so low that it's undetectable, how would tests determine whether this patient is even still positive?
So the question to this is something that we were already discussing. Most of the tests that we do don't look for the virus itself. It looks for antibodies. And the
Right.
antibodies will stay positive for life. Yeah. So when we talk about, in everyday language, I'm getting an HIV test, almost all of the time we're referring to an antibody test.
Right.
So regardless of whether someone is has a detectable or undetectable viral load, the antibody test will be positive.
Right.
Humans are damn smart.
Yeah.
Sorry,
Never.
Alison hasn't told us whether she's positive or negative.
She would
I'm-
rather not say.
Okay.
I'm
That's fair
negative.
Okay, anyway.
Denise and I also too, by the way.
I don't know.
Oh, yeah.
The fact that you all never offer is like, maybe I ask her
Okay, but
after
John
lah.
didn't offer either.
John didn't even want to test.
Yo, I do want to say I accidentally went for the test.
Huh?
Because I went for a full body checkup. No, so the nurse came to me and they drew blood for the normal full body checkup. And then she said, and then afterwards she came to me with an iPad and said, do you want us to also do a HIV check? But if it's positive, we do need to inform the authorities. Then actually I not scared one ma. It's like I want China ma. So then, but then when she like asked me that way, I suddenly a bit scared. Yeah, then I said yes anyway lah. Because like then, like now that I know so much from you, right? Then I just took the test and it's negative lah.
But the doctor who did the test with me, right, I asked him if I'm positive, right, will you have to report it to the authorities or whatever? Then he said no. You'll just be assigned like a number, right?
Yeah. So that's because you did the test at an anonymous test site, right? So there are 10 anonymous test sites in Singapore. One of them is Action for AIDS. The other 9 are sort of at GPs, which are sort of all across the island. If you want to find out where these anonymous test sites are, you can go to the HPB website.
Okay, we will link down below in
Yeah,
the
we'll put it
description.
underneath.
So there's a list of those clinics, and at those anonymous test sites, they as you experience, they don't take any information from you. Ultimately, if people do test positive, we will usually strongly encourage them to seek treatment. And of course, once you seek treatment and you go and see a doctor, then you will have to be sort of registered and then notified at that point.
see.
But the reason why anonymous testing is great is because I think it lowers that barrier for people to do their initial tests, right? And that's why it's so useful. Yeah.
But how so for like people like us that did the self-test, right? How reliable is the self-test? Because it's like really it's just swab then. Like to me, I'm not sure.
Yeah, I can trust or not.
So when we talk about how reliable a test is, we're actually looking at two things. How specific it is. So how likely we are, how confident we are that it is telling us the correct diagnosis, and how sensitive it is, which how likely it is that we are able to pick it up given that we are positive. So for both of these statistics for the test that we are using, right, it is very, very highly accurate. So we're talking more than 93-94%.
Right.
So the test is very reliable. The technology that we have nowadays to detect, even antibodies and so on in body fluids is very reliable.
Okay, I have an important question from Just Nick. He actually asked us on Instagram. So why is there a stigma when I ask a partner to get tested for family planning? So I think like a lot of us like, say if you are going on a first date, for example, and then it turns out well, and then, but then you want to have sex, but you're not sure whether this person like is positive or negative, ma.
Yeah.
Then how can you politely ask this person without trying to like insinuate that like they are like too risque?
How would I do
know
it?
what I mean?
Yeah,
Like,
that is such an
I just
awkward
asked
question.
Like, do
You-
you?
Then they say no
Have
lah.
you?
Like, why would you
Yeah.
suspect that I have?
Wait, so you have asked a partner in a scenario?
I just curious, ma.
Yeah.
I like, hey, did you get tested before?
No.
Then do you
Then
insist?
can you go get tested?
Have you gotten tested?
I don't need because I was non-sexually active.
But I was always protected.
No, just go test.
This is the weirdest.
No, I just was curious.
So I mean,
Both people here are
if,
wrong.
if we won't play that right, I feel this is a stereotype. I feel like it's easier to get a guy to go and test than ask the girl to go and test. Because like the insinuation that you sleep around it might be too much. Whereas for guys, they could be proud of it. I don't know, right? Society could celebrate it.
He could have only had one partner and still want to do it just to
Yeah. Like there are guys that I know that have only one sexual partner, but they pretend they had three. Just so, you know what I mean? Just so.
Yeah.
Yeah.
So I think from my professional standpoint, I would say that the fact that you all felt that it was an awkward conversation is a reflection of real life, right?
Yeah.
I think conversations about sexual behavior and sexual experience and so on will vary wildly between couples, between different individuals. But of course, the more information you have about your partner, the better the more informed the choices you can make. And definitely talking to each other honestly and openly about your sexual experiences and your level of comfort around knowing each other's status is a healthy part of the relationship. But it's not something that as a doctor I can give the best advice on that will apply to everybody in every situation.
No, what do you tell your children?
So what I tell my child is that the best thing is that you will never truly know what the experience of someone else. The only person that you can protect is yourself. The only person that you can trust is yourself. So that's why getting testing for HIV is so important, because you know your own status, and then knowing things like ABCD, knowing things like the existence of PrEP and PEP will allow you to make the best decisions for yourself. Because I always tell my own patients and my own, like in clinic, right? Will you not use a condom just because someone else said that they are, that they don't have any STIs? Will you not use PrEP just because someone tells you that, hey, I don't have, there's no reason for you to
Suspect,
worry,
yeah.
right? So that's why I think it's important to realize that the measures that we talked about just now are measures that you can take to protect yourself. That doing an HIV test is for you to know your own HIV status. Obviously, if you are in a relationship where you can talk to someone and there's that level of trust and so on, then that allows you to make further decisions. But ultimately, you can really only be sure of your own status and take measures to protect yourself. Yeah.
So what would you all do if, let's say, you and your partner when you get tested together and then you found out one of yours positive? Doctor?
I will take the PREP pill and he will take the PEP pill.
Wait, you take the PR?
Because if he kena,
Prep.
then I'm the negative.
Oh.
Yeah, I think it depends. Like, when, right? And then, I guess it's what the
You
drama
wouldn't know,
unfolds
right?
first
Yeah.
because it's like, hey, how did you get this? You didn't have this before, etc.
No, but how you know they didn't have it before?
Yeah, that's true. Because maybe they never get tested,
Yeah,
right?
until this date.
So I think if you get past that and realize that, okay, she's still trustworthy in that sense, then go through the plans. We start going for the HIV medication. It will get to a point where it's suppressed. This is not the dramatic story John was looking for.
Yeah.
So
No, but
I will take it a step back.
In the past, a very real and feasible idea, I mean, especially if you all have yet to begin a sexual relationship, like a very feasible plan is to say we have to break up.
Yeah.
But we've come so far that actually is, oh shit, we need to go and buy medicine. You know? Shit, every morning you take that thing. It's about it.
So if PEP is positive, will your first thought be like, oh, she slept with someone else? Or will you be like,
Wait, how else can she get it?
she can get like
A cut lah.
cut.
Wow, so would I believe if she told me she got it from a cut?
No, she said.
She like, I don't know how.
Might be. Then after that,
That's not possible. That's not possible.
So maybe my suggestion.
Yes, the very timely.
Of course, the conversation between the couple would be, you know, something that's deeply personal, right? That I will not comment on. But the first thing I think, as you pointed out, most important is for the person who is infected or who is, you know, now discovered that they are living with HIV to go get treatment. To see a doctor, start treatment, get the viral load undetectable as soon as possible. It's important for the other partner to also get tested as soon as possible.
Yeah.
Right, because you need to know sort of what your own HIV status is. If you are also HIV positive, then the same pathway is there, right? To start treatment, get in good health. If your HIV status, you know, within the relationship is different, right? What we call serodiscordant. One is positive, one is negative.
So
then
unnecessary.
we will need to take the prevention measures that we've been talking about. Right? PrEP is an option. Of course, not sexually active for a period of time until at least the person with HIV is undetectable is another option.
Right.
Using condoms all of the times is a third option. And then, or some combination of all of the three.
Right.
Yeah. So that would be, you know, what we would need to do.
Right.
From a sort of health perspective. Yeah, of course, there'll be some...
But the trust perspective.
That one, he cannot advise.
we need another expert on that one. Couples therapy expert.
Love guru, which is John Paul, who's in the jungle now.
That's true.
Okay, shout out to John Paul. Thank you for protecting our country.
Hey, by the way, John Paul doesn't know his HIV status, or he need to go and get tested.
He has somehow
No,
escaped.
the SAF checks you.
Oh. I think like something that I was kind of thinking about, because at the start of the video, I mentioned that a lot of people don't see a need to go and get tested, and that was me.
Yeah.
Because like, I'm not sexually active, and I don't. I mean, my parents have never said anything to me, so I don't. I assume that I'm not a carrier either. Then I just always wondered, like, why should I even go and take this test? But then just now when we were taking the test, then actually I was a bit scared. I was like, wow, this could have. I might have got it just from somewhere, and you just never know. So it's important to get tested.
I feel like it should just be part of like your annual health checkup.
Which people don't even do.
Yeah.
Like we talk about the importance of early diagnosis, right? What are some repercussions of late stage diagnosis?
So I think the later we are diagnosed after being infected, the more time would have passed, the more the virus would have had an opportunity to attack your immune system, and the more likely you are to fall sick. The other repercussion of that is also that the longer a period of time has gone by that you did not know that you were HIV positive, the higher the chances are that you may have unknowingly or unwittingly transmitted it to someone else. Right? Because it's only if you know that you can take precautions so that you don't infect, you know, your sexual partners, people you care about, people you love, and so on. So I think those are the two main repercussions. In the local context in Singapore, we see that, you know, from data from last year, for example, more than half of people who were newly diagnosed with HIV were diagnosed at a late stage of infection. And it does mean that...
Late is how long later?
Late meaning that their immune system has...
I see.
Has
Compromised already.
been compromised to a certain degree. Yeah.
And how long does that take? Like, sorry, just wondering.
It's quite variable. Generally, we think that it takes about 7 to 10 years. Before someone starts to have like a really truly weakened immune system. In some people it can be faster, and some people it can be slower, but on average, you know, the range that we usually talk about is about 7 to 10 years.
Right.
Yeah. So when you present at a later stage and your immune system is weakened, then the risk of getting certain kinds of infections, even certain types of cancers, is a little bit higher. Most of these, thankfully, we have the treatment, to sort of help people through that. But it does sort of increase the risk of just falling sick.
Yeah.
Yeah.
Sorry, this is quite mind-blowing to me because like if most people only kind of detect it when they are late stage and it only comes about after 7 years, they could have had multiple partners in that time frame, passed it on, and then now after 7 years you have to trace back and tell everybody that that's
Yeah, so I think that kind of highlights the importance of
early testing and
early testing.
Look at this part.
Or
But-
counting your
Yeah,
sexual
you need to
encounters.
contact trace. I know this. I call one person. Yeah.
19
for-
December 2001.
I think the challenge always is that, you tell people that they have to test early, but testing early is a little bit meaningless. And I kind of think that the more important thing is to just tell people, do you know what is your risk of having HIV, right? Are you sexually active? Especially if, do you have multiple partners? Is, the use of condoms perhaps not like 100% of the time, and maybe you don't use other kinds of protection. Then knowing the risk is one thing. And then giving them information about how and where to get tested and the importance of getting tested is the other thing. And putting those two together would give you hopefully give you a situation where people are aware of their risk, they know they should get tested, they get tested regularly. And when you test regularly, hopefully we will detect the diagnosis or the infection earlier.
Right.
Yeah.
I think the self-test kit genuinely helps so much. Like I don't even need to go like all the way there.
Yeah.
Yeah, and we've gotten to a point where people are so used to testing themselves for COVID also. Testing before you go out, testing before you go to work. And so I think it really helped in terms of that culture of like just testing so that I don't spread it to anybody else. Yeah.
Definitely.
So this one might be a bit contentious. I'm not sure when I'll read the name, but anyway, the comment says homosexual transmission is the main mode of HIV transmission.
So I think
true?
that is a misconception, right? HIV really does not discriminate, right? It does not transmit more easily through sex between people of the same sex or the same gender, as opposed to people of opposite sex and opposite genders, or different sexes and different genders. In some countries around the world, we do see that more people of a certain sexual orientation are affected by HIV more than others. But this does not mean that HIV preferentially chooses.
Or why
certain
is that
people
so,
to
you
get.
think?
I think there are many, many different reasons for this. In some situations, it could be because people of a certain community are less able to access prevention, or maybe there's less information and education out there to target this particular community. I think there are numerous other sort of reasons behind it. But the main point here for everybody to understand is that it does not discriminate between people of different sexes, different genders, different sexual orientations and gender expressions. Yeah, and that knowing that would be a first step in, of course, telling everyone that or clearing up a certain misconception around risk, right? Because we don't want people to think, hey, I don't belong to this particular community, hence I don't have any risk of HIV.
Yeah.
But the second thing is that it will go a long way towards destigmatizing and reducing a lot of the stigma that surrounds both people from the LGBT community perhaps, but also stigma around HIV itself. Yeah.
So just to round off, right, what should I do after I get tested? Say, for example, if I'm negative, I will assume I just go on with my life and maybe remember the ABCDs, right? But if I test positive, then what do? Just not ask my boss whether I can go home. Then he say, if you think going home helps you, you can go home. Then, yeah. So what should I do if I do happen to test?
Not me, that was not me.
Another boss.
Yeah.
Okay, so I think the test positive one is a little bit easier to answer, right? Once you have tested positive, I think first and foremost, it is to make sure or to confirm that the test is truly positive. We're talking in the context of, let's say, somebody who's done a self-test at home and is tested positive. We will always say the instructions on the self-test kit, if you've read it, would be that, return to the place that you bought this test from. So either the DSC clinic or AFA, and then they will do a repeat test for you, right? All HIV testing in Singapore is a 2-step process. So both the first step and the second step need to be positive before we say that someone is truly HIV infected. I think the next most important step is to be linked up to care. That means to go and see a doctor, somebody who's an expert in HIV, and then that discussion we'll kickstart that discussion on, treatment and starting treatment as soon as possible to have an undetectable viral load, so it's good for your own health and also to prevent transmission onto other people you care about. So that's, I think, what happens if you're HIV positive. And also to know that there is there's a really strong network of support, not only for a person's physical health and medical health, but also, to support them through what can sometimes be a challenging journey. For people who test negative on an HIV test, there's a few things to think about. First and foremost is whether or not you are within the window period of testing. Remember, because if let's say your last high-risk exposure, and we've sort of gone through what high-risk exposures are, was within the last 1 to 2 weeks, then we probably know that a repeat test will be required so that we are very confident that somebody is negative.
I guess I'm very confident I'm negative.
Good.
Sure.
So if let's say
Same.
Same.
So if let's say the window period is you're past that window period, right? There was no sort of high risk exposure, no sexual activity, and so on within that window period that you did the test, then I would always tell people that the next step and the next strategy is to stay negative. Right? To be very aware that a negative test now is not like your driver's certificate, right? You get once and then you got your driver's cert for life, right? It just tells you that up to that point, you have not been infected, right? So the next step to stay negative, use the sort of HIV prevention methods that we were talking about, whether it's PrEP or ABCD, and practicing those things. But also, if there's going to be ongoing risk activity. So if you are sort of sexually active, to get tested regularly and repeat the testing as appropriate. For most people where there's sort of ongoing risk behavior, we recommend getting tested every 3 to 6 months.
Okay.
So we know.
Can I walk to one of the clinics, right, and buy 10 boxes, just keep at home, that kind?
So at the current moment that we are speaking, the HIV self-test kit is only available in 2 places. So the DSC clinic, right? So the one in Clinton Lane, and Action for AIDS.
Right.
And at the current moment, because we have just introduced this project.
Oh, it's okay, yeah.
Yeah, it's a new
one
thing.
of the first few.
Yeah. So we are saying that people can buy like 3 boxes or 3 kits at a time.
Right.
But of course, if you've used the 3 kits and you want to go back and buy more, you're welcome to do
Right.
so.
It's just a logistical issue. Just want to make sure that's enough for everybody. So
Correct.
at some point in due time, perhaps you can buy like an ART kit.
We hope so. We hope
Right.
this is what will happen.
Okay. If you are getting serious with your partner, right, here's a few things that you need to do. The first one, right, get her ring size. Ask early. Don't wait until serious then ask, because then she think, oh my god, he gonna propose already. Ask early.
Yeah. When it's so unreasonable that you will do it.
Go fat.
At the point that she know you're not going to propose anytime soon, that kind.
That's the time.
Ask for it first. Then aga find out whether her this finger is your this finger. Usually it's like that. Then do a fertility health check.
Nice.
Because most of fertility issues are treatable and just takes time to treat. And then do a HIV test.
It can be a couple activity.
Yeah. What a big idea.
Oh my god, that's how we rebrand it. We make it a couple activity. Next time, right?
Yeah.
TSL or
After
honeycombers or
pottery.
whatever. Things to do on the weekend. Oh my god, exactly.
Yeah.
It shows
it affirms commitment to each other.
exactly. It says that you guys want to be together forever.
So aside from anonymous test sites, right, where else can I go and get tested?
So you can get tested actually at almost any healthcare facility. So we're talking about clinics, polyclinics, hospitals, and so on. Of course, outside of the 10 anonymous test sites, all other HIV tests done would be you need to register. Right? Of course, what we talked about just now at the DSC clinic AFA, we're also selling the home test kits, the self-test kits that you can buy, also without necessarily needing to give any personal identifiers. But apart from that, if you have a GP, if you've got a polyclinic that you go to and you request for HIV tests, they should also be able to do it for you.
Actually, what happens if you're indexed? So I go to a GP and then I have...
So all HIV tests that are done in Singapore that are positive and are not done under anonymous test site would be notified to the National Registry lah.
Then
And they use this registry basically to keep track of how many sort of new diagnoses there are every year. They will also sort of contact the person to sort of ask them a little bit about whether there's any sort of
Contact tracing lah.
that may need to be tested as well. And that's generally about it.
so fair enough lah, right? You're gonna need treatment anyway, what, right?
But it won't be like, let's say I apply for a job, it won't be somehow in my SingPass.
No.
Okay.
No.
I don't know.
It's a good question.
yeah,
Yeah.
No. So that's an excellent question.
Help.
And the answer is no.
Yes.
The answer is no.
No.
And in fact, you will not be able to look at your HIV results on Health Hub either, because
Right.
it is a more sensitive test result lah.
Right.
Good.
Okay lah.
Yeah.
So the implications of getting indexed is like COVID lah.
It's alright. Yeah.
So the red ribbon has been a symbol of HIV and the fight against HIV for almost 3 decades now, since the fight against HIV really started. And it represents unity and solidarity with people living with HIV, as well as the many people whose lives have been lost to HIV. And putting it on every year during World AIDS Day is a symbol of our ongoing commitment to fight HIV. So I'll pass one out to each of you.
Whoa!
Okay.
Yay! Thank you so
Wait
much.
for the outro.
There you go.
Oh, thank you.
Thank you, sir.
Wow.
When is World AIDS Day?
1st of December.
1st of December.
Oh my god, we're in time. We're in time to support. Thank you.
Yay, thank you.
Thank you. Okay, we've come to the end of the episode. Once again, thank you to the National Centre for Infectious Diseases for being our partners for today's episode. Please go and get yourself tested. That's the only way to know what your HIV status is, and knowing your status, whether positive or negative, is a great relief. Early treatment can help people living with HIV stay healthy and protect their loved ones. Also, don't forget to check out our previous episode for more information on HIV. Thank you, Dr. Wong, for joining us again today. Yes, and there are also links down in the description box for more information, as well as the testing sites. Yeah, so check those out. Thank you for watching. We'll see you in the next one.
Goodbye.
Bye-bye.
Bye.
This
Do
morning,
keep-
Alison asked me like if I kiss someone or something. Then after that, I stand out and asked Dan. Then Dan also not very sure. Then we all had to Google.
Huh?
So like if you kiss someone and then both of y'all got the ulcer, then the ulcer got like a cut, then
Got a chance lah.
but in
Small
a very
chance.
specific
Yeah.
scenario
Yeah,
lah, which
yeah.
is like less like
We
that.
asked for a lot of specific scenario. Also, like if your arm and my arm is here, right, then the mosquito bite me, then straight away
then
come in.
Cannot.
Must
Cannot, by the way.
Cannot.